Hi there, my name is Connor Mitchell. I'm joined with Gabriel Holguin, Kendra Silvas, Nika Munoz, and Harinder Gill. Today we're going to be talking about the topic of cirrhosis. We chose this topic because of its high prevalence within San Joaquin County and our local communities. In this video, we hope to educate you on the basics of cirrhosis as a disease, walk you through the risk factors, and highlight how you can find treatment for yourself or for your loved ones.
So, if you spent any time in the social scene of San Joaquin County, you might have realized that there's a whole lot of people with very little to do. Don't worry, alcohol is here to fix that. Don't believe me? Just take a look at these figures and see for yourself. San Joaquin County has higher rates of excessive drinking when compared to Healthy People 2020 national statistics. San Joaquin County has nearly 50 deaths per 100,000 compared to the average of 34 in the rest of California counties. How's that possible? Supply and demand. San Joaquin County has identified 10 separate priority neighborhoods that have a high concentration of alcohol outlets, higher than 77% of other counties in California. So what does that mean? That means a whole lot of people are drinking and dying from it in San Joaquin County. The breakdown is about 32 males and 16 females per 100,000 people. And it's not just San Joaquin County compared to other California counties. The University of Washington Institute for Health Metrics and Evaluation analyzed the performance of all 3,142 U.S. counties in terms of cirrhosis mortality, and San Joaquin County ranked 2,714th out of all counties nationwide. That's 86% higher than all other counties in the nation when it comes to deaths due to cirrhosis. Wait, you don't know what cirrhosis is? Well, let me tell you. Cirrhosis is a condition in which the liver is scarred and permanently damaged. Scar tissue replaces healthy liver tissue and prevents your liver from working normally. Scar tissue also partially blocks the flow of blood through your liver. As cirrhosis gets worse, your liver begins to fail. Many people are not aware that they even have cirrhosis since they may not have signs or symptoms until their liver is badly damaged. People are more likely to get cirrhosis if they've abused alcohol for a long time, have type 2 diabetes, are males, and are older than age 50. But that doesn't mean wait until you're 50 to prevent it. Researchers estimate that about 1 in 400 adults in the U.S. have cirrhosis. Cirrhosis is more common in adults ages 45 to 54, with about 1 in 200 in that range having cirrhosis. Researchers believe the actual numbers may be even higher because people with cirrhosis are not always diagnosed.
Signs and symptoms of cirrhosis can be very vague, or you may not even have symptoms at first. Some people experience fatigue and weakness, a lack of appetite, and weight loss. Later on, a swollen stomach and jaundice, which is yellowing of the eyes and skin, can appear. You can have nausea and vomiting, and you can also develop spider-like veins in the skin of the arms and the legs. Some complications of cirrhosis can include swelling or fluid in the abdomen, which is called ascites, can cause toxins to build up in the brain, such as ammonia, can cause your spleen to get swollen, and you can be at risk for bleeding, can cause bone diseases and high blood pressure in your liver veins, such as portal hypertension. It can cause swelling of veins in your esophagus, can lead to an increased risk of infection, and an increased risk of liver cancer. So what causes cirrhosis and what makes it worse? Well, the number one cause of cirrhosis is alcoholism, or drinking excessive amounts of alcohol for a long period of time. Hepatitis is another runner-up to cirrhosis causes, fatty liver disease, certain kinds of infections that affect the liver, medications, chronic use of hepatotoxic medications can cause cirrhosis, and there are certain genetic disorders that can cause cirrhosis of the liver. What makes it worse? Well, continuing to drink alcohol can make cirrhosis of the liver very much worse. High-risk sexual behavior, putting yourself at risk for hepatitis. Drug use, especially intravenous drug use, can put you at high risk of developing hepatitis. Heavy use of hepatotoxic medications can cause cirrhosis of the liver and make it extremely worse if you already have some underlying liver disease, poor hygiene, and poor diet and lack of exercise.
Here are some ways on how people with cirrhosis can manage their disease. Patients who drink alcohol must stop all alcohol consumption since any amount of alcohol can be toxic to the liver. It is also important to cut down on salt intake to help prevent swelling or that fluid buildup in the abdomen. Keep a healthy body weight, and by exercising for at least 30 minutes to an hour per day can help reduce fat in the liver. Finding other methods to relieve stress without the use of alcohol, such as meditation, exercise, or music, can help with coping. Getting routine follow ups and taking medications as prescribed to monitor disease progression as well as prevent complications. It is also important that patients with cirrhosis to avoid taking NSAIDs for pain, since it can increase the risk for acute kidney failure as well as decrease the effects of medications such as diuretics. Patients can check with the doctor if any of the medications they're taking are NSAIDs. So Tylenol can be taken for pain instead, as long as the recommended dose is followed. The American Liver Foundation created the Mind Body program in December 2020, where they help address the patient's physical, emotional, and mental well-being. They explain the concept of mindfulness and how it can be beneficial for the patients to cope with their disease. They also provide tools for self-care and techniques for physical, emotional, and mental self-management. The workshop is divided into 3 sessions, which can be found on their website, liverfoundation.org. Now let's talk about how we can prevent liver diseases, which can later on result in liver cirrhosis. First is to limit alcohol intake if abstinence is not possible. And again, people with liver disease should not drink alcohol at all. Keep a healthy body weight since excess body fat can damage the liver, so being overweight can increase that risk for having a fatty liver disease. Exercise can help burn the fats and prevent a fatty liver disease. Eat a well-balanced diet, low-fat and low-salt diet, and avoid processed foods if possible. Maintain regular visits to the doctor, and since most people are asymptomatic at first, this can help detect liver diseases early. And for people with liver disease, make sure to take medications as prescribed and keep all appointments as recommended by the healthcare provider. Liver diseases can also be caused by a virus, and the best way to prevent ourselves from getting hepatitis A and B is to be fully vaccinated, along with hand washing, proper food preparation, and avoidance of raw shellfish. There's no vaccine available for hepatitis C, so it's important to avoid high-risk behaviors such as unprotected sex or illegal drug use, where people often share needles. If there's any circumstance where you may have been exposed with contaminated needles or blood, you should get medical care immediately.
Some pharmacological nursing management treatment are using potassium-sparing diuretics, spironolactone or aldactone, which is used to decrease the situs and pleural effusion. Lactulose, which helps eliminate the ammonia from the blood into the bowel. Propranolol, which is an antihypertensive medication that may be ordered to help lower portal hypertension. Some surgical interventions include paracentesis, which is performed to remove fluid from the abdomen and relieve the pressure on the diaphragm and the lungs. A transjugular intrahepatic portosymptomatic shunt TIPS procedure, which is the treatment of varices by upper endoscopy with the banding to relieve portal hypertension. Community help and resources. The community could introduce educational programs meant to train people on causative agents and management of the ailments, as well as reduce anxiety. Setting up resources centers for treating cirrhosis will enable patients with this ailment to access affordable medications, especially for liver transplants. Many people with cirrhosis have been stigmatized for being alcoholics and would hardly get any support from the family members or community to manage the ailment. It would be essential if the community is educated more about the causative agents of cirrhosis and stop associating the ailment with alcoholism. This will enable the community to accept the affected and advise procedures that would support cirrhosis management. One of the federal programs is SAMHSA National Helpline, which is a Substance Abuse and Mental Health Services Administration, which is a program. This program is a confidential, free, 24-hour a day, 365-day a year information service for individuals and family members facing mental and/or substance use disorders. This provides referrals to local treatments, facilities, support groups, and community-based organizations. So this program can provide you more information about Alcohol Anonymous, which is available in almost every city, and it's a local program to help people with their drinking habits and promote healthy lifestyles.